Hello colleague, welcome to this short educational presentation which is aimed at refreshing your knowledge on the process of supervision. This programme is intended to supplement the information contained in the short introductory video presentation introducing you to the pilot project. I will provide you with an overview of what reflective supervision is and go through the information that will support you to prepare for your supervision session. Firstly, a brief overview of the background to supervision in Northern Ireland. NIPEC were commissioned to complete a regional review of clinical supervision in Northern Ireland in 2006, which resulted in the development of two standards for supervision in nursing, launched by the then Chief Nursing Officer Martin Bradley in 2007 and implemented into service through work led by NIPEC in 2008. The two standards were as follows. Standard 1. Supervision can contribute to the delivery of safe and effective care when practitioners have access to appropriate systems that facilitate the development of knowledge and competence through a culture of learning by reflection. Standard 2. Supervision will become an effective tool to improve the safety and quality of care when it is embedded within an organisational framework that supports effective leadership and performance management. Following the publication of a review of midwifery supervision in Northern Ireland, legislative changes came into effect in April 2017. Removal of this additional layer of regulation means midwifery supervision will continue in a non-statutory format, with the governance of midwifery practice resting with employers. So a definition of reflective supervision. Supervision is a participative process of supported reflection that enables individual nurses and midwives to develop personally and professionally to improve the quality, safety, and person-centeredness of their practice. So the word supervision, here are some examples of the benefits and opportunities for you using the supervision process. It's an opportunity for you to be afforded protected time to explore a topic which is significant to you, a topic of your choosing with an experienced supervisor. Supervision processes have also been recognised as a method of improving organisational recruitment and retention of staff and have an established association with job satisfaction, increased autonomy and reduced absenteeism. The process of supervision has been evidenced to provide a protected space to discuss a topic which is potentially very significant to the supervisee with the support of an experienced supervisor. The supervision experience can enable you to identify potential learning needs and discuss and agree strategies to address any identified gaps requiring exploration of evidence to inform and update practice. The supervision process allows you protected time to consider issues or challenges you may be facing and allow you the opportunity to prepare how you may deal with a particular issue moving forward. Empowerment has been defined as the process of becoming stronger or more confident. Within supervision, guided by your supervisor, you will be encouraged to use a model of reflection to potentially come up with your own solutions to challenges you may face as a registrant. Supervision can also enable us to critically reflect. Through a process of guided exploration and probing questions, we are supported to think about our practice and ideas, and then our supervisor may gently challenge us to step back and examine our thinking. Within the protected space of supervision, we are supported to explore a potential issue and explore ideas and possible solutions. We can be supported to be a visionary thinker and practitioner. Often we have creative ideas of how a system, process, or management of a particular scenario may be tackled differently. This can also tap into innovative practice where we are supported to discuss and potentially seek to forward an idea or new way of working. Supervision helps us to improve our self-awareness by supporting us to reflect on our behaviours, feelings, and attitudes when discussing a topic during supervision. Supervision can inspire us to make necessary changes in our practice to fundamentally improve the care of the patients we care for. Supervision requires us to have two-way open and honest dialogue with both parties in supervision to enable a conducive learning opportunity. Lastly, supervision is a forum for us to realise that something which we may find challenging or difficult may be a similar experience of colleagues and peers. This can be reassuring when we realise that we are not alone, when we sometimes can doubt our capability and question our feelings about something we find challenging in our practice. Here are some topic examples for you to consider in preparation for your supervision session. This is not an exhaustive list, but will give you some ideas. In advance of your supervision session, you have a responsibility to prepare a personal reflective account, including any actions you may have made or intend to make. The written reflection is your own personal record, and the content of the session is owned by you, the supervisee. It is your responsibility to store this appropriately within your own electronic or hard copy professional portfolio. You may wish to use NIPEC's online portfolio at the address below, nipecportfolio.hscni.net, which allows reflection within the templates provided by the NMC supporting revalidation. There are a few reflective tools that you may use to support your exploration of your supervision topic. The purpose of using a reflective model is that they are designed to encourage us to explore our own beliefs and assumptions and to potentially find solutions to problems. These include Gibbs, Rolfe and Kolb models as some examples, though you may wish to use your own reflective model. You may record your reflection on an NMC reflective topic template form. It is important to have your written reflection prepared in advance and with you during your supervision session, as it is helpful to refer to during discussions to keep you focused. When you're ready to choose a supervisor for your supervision session, you will log on to the NIPEC website using a secure PIN code provided to you in advance, which allows you access to a trust-specific platform on the website. Details of how to access the site will be sent to you in advance via email. On the NIPEC website, you will be presented with the profiles of each supervisor involved within your trust in the pilot project. You will be able to book a supervision session with a supervisor of your choosing. The supervision session will usually last up to 1 hour and will most likely happen in a remote learning format due to current restrictions. Privacy and confidentiality will be promoted by both supervisor and supervisee during the supervision session and afterwards. The exception to this confidentiality is where an issue of concern arises and further referral is required. In this context, the supervisor may be required to make a record of the conversation. In this circumstance, you will be informed of the requirement. As per NMC Guidance on Reflection for Revalidation 2019, it has been highlighted that any notes or reflections made by registrants are anonymised so that no patient, colleague, service user or other individual must be recorded to ensure no one can be identified. Information must not include the name of any individual, the date of any event or incident referred to, the ward or place where the event occurred, and lastly, any descriptions or unique circumstances where an individual could be identified from the circumstances. This is your property and you will not be asked to provide this unless you choose to do so yourself. Although supervision can be either a group or one-to-one format, for the purposes of the pilot project, you will be availing of one-to-one supervision. Following an exploration of your topic, facilitated by the supervisor, you may agree some actions for you to carry out. The acronym SMART is a good example of a way to keep your actions focused, and SMART stands for specific, measurable, achievable, realistic, and within a specified time scale. Be open to feedback to enhance your own development and learning to improve care as a result. Thank you.